Hello there. This is Dr. Hansen, Carl Hansen. Today is part two of two-part episode on Healthshares. The first one was done mostly regarding advice towards individuals, but this one is part two is specifically to any employers out there that are interested in providing health insurance, health coverage for their employees. This would particularly apply to individuals with employers with 50 or less employees. The Affordable Care Act mandates that larger employers have to use the typical policies, but this applies to essentially the small businesses of under 50. A lot of times you as an employer do want to provide some sort of healthcare coverage for your employees because you appreciate them, because it's beneficial for you as a company if these individuals get diagnosed early, if they stay healthy, if they have access to a physician on a reasonably rapid basis. Many employers have noticed, however, that next to employee salaries, the biggest expense for your company is going to be healthcare costs if you dare to take out a policy. And if you do take out a policy, for example, a typical Blue Cross policy for your company, you know that every year it goes up 12%, 10%, 15%, and your broker simply says, well, that's just the way it is. Healthcare is so much more expensive these days, and I recommend that as your broker that you re-sign with Blue Cross or whoever and continue. Know that your broker is not looking out for you as a business. The typical broker is incentivized by the health insurance industry to have you as an employer keep signing up with the same super expensive confiscatory rates of these insurers. So if that broker gets you to sign up with Blue Cross again at a 15% higher rate, the broker gets an incentive to do so. So know that the broker is incentivized to help themselves, not to help the business. So how do you solve for this? Well, if you could get a healthcare consultant, and I do know of some, I'm not going to publicize them because I don't want to appear as I'm promoting a specific individual or company, etc. But you want a healthcare consultant that's assessing your business and looking at all the different options. One option as an employer, you could just say, well, I can't afford coverage for the employees, but I can afford a direct primary care membership. So I can afford an average of $75 a month to cover each employee. So at least that they can see a direct primary care family physician, so that they can see that physician, contact the physician as soon as they get ill. That physician can help them engage in preventative medicine. That can help you return to work. That can help you avoid missing work. That can help you actually become healthy, because that's an important thing. It's not full coverage, but the employer, you as an employer, can provide coverage to have your employees actually have access to somebody, which is really important. People want to be able to talk to their doctor and interact with their doctor. That's something that's more and more missing these days. So an employer can go that level and just do a direct primary care membership. The next step, however, is really what I'm talking about is, let's say you want to provide as an employer greater coverage. So if your employee gets appendicitis, if your employee tears up their knee, if you need to have coverage for that kind of stuff, you think, well, I have to take out a big insurance company policy. You do not. There are these entities out there called Healthshares, and there are several. They are way cheaper than the typical insurance model, the Blue Cross United policies, if you will. They work in a similar fashion, except with all the graft and corruption. So you're not having to pay extra for all these little nuanced features that allegedly may help your company. No, what you're providing is a reliable, time-tested system where you can pay a smaller amount per month, or you could have that split with your employee to give them coverage. So not only are you giving them coverage to go see their primary care physician as needed, but you're also giving them coverage if there's something more big ticket that comes around. So now as an employer, you can advertise and get employees better because you can say, hey, I'm providing a primary care physician for you, and I'm providing coverage should something big hit that you would actually be covered for. But it's going to cost you as an employer much less to do so. The health share and the employee is now engaged in a favorable ethical and philosophical arrangement where they're actually looking out to reduce healthcare costs. So it is beneficial to everybody. The sooner we disconnect from the typical health insurance industry, the better. But I would just like to point out to the employers, if you haven't looked at my first video regarding this, please check it out, part 1 of this, and then consider these. And if you can get a healthcare consultant, I can give you a name of somebody. But I just think philosophically, think about this, and then reach out to whoever, family medicine physician near you, direct primary care physician, to see what they can do. So I hope this helps some as an introduction to know that you employers do not have to be under the noose of the health insurance industry, that you can still provide your employers with some excellent coverage that is way less expensive. All right, thank you for listening. Take care. Bye.